Dear viewers, now we are discussing about antagonist and classification of antagonist. Stay with us.
Welcome to our YouTube channel MedBasic21. You can subscribe, like and share. MedBasic21.
Antagonist, a drug which has affinity for receptor but lack of efficacy, is called an antagonist. Antagonist inhibits the function of agonist. Like H2 receptor blocker, ranitidine. Classification of antagonist. Antagonists are subdivided into three types: competitive antagonist, non-competitive antagonist, and uncompetitive antagonist.
Competitive antagonist. Reversible or irreversible. Competitive antagonists reversibly bind to receptors at the same binding site of agonist or endogenous ligand without activate the receptor. Agonist and antagonist compete for the same binding site. Higher concentration of antagonist will be required to obtain the same degree of binding site occupancy. The effect of a competitive antagonist may be overcome by increasing the concentration of agonist, such as H2 receptor blocker competes with histamine and binds with histamine receptor and decrease the acid secretion. Irreversible competitive antagonist involves competition between the agonist and antagonist, but the rate of covalent bonding differs and depends on affinity and reactivity of antagonist. Once irreversible bonding has taken place, the receptor is deactivated and degraded.
Non-competitive antagonist. Non-competitive antagonist is also known as allosteric antagonist. Binds to a site other than the agonist binding site, exerting their action to that receptor via the other binding site. The bound antagonist may result in a decreased affinity of an agonist for the receptor or induces a conformation change in the receptor such that the agonist no longer recognizes the agonist binding site.
High doses of an agonist do not overcome the antagonist in this situation. Like GABA receptor. Irreversible antagonist covalently binds to receptor permanently, and they cannot be overcome with agonist. Inactivating the receptor for the duration of antagonist effects is determined by the rate of receptor turnover, i.e. the rate of synthesis of new receptor. Example, phenoxybenzamine, an irreversible alpha blocker, permanently bind to an adrenergic receptor, preventing adrenaline and noradrenaline from binding.
Uncompetitive antagonist. Uncompetitive antagonists differ from non-competitive antagonists in that they require receptor activation by an agonist before they can bind to a separate allosteric binding site. This type of antagonism produces a kinetic profile in which the same amount of antagonist blocks higher concentrations of agonist better than lower concentrations of agonist.
Thanks for watching. You can subscribe us.